Hi, I am the emergency room doctor today. I am an ER attending. I have 6 people that need to come in.
Hello, my name is Dr. Davis. I am with the Internal Medicine Service. I am currently trying to manage the patient you called me about earlier. Can I discuss these patients with you after I finish speaking with this patient?
No, these patients need to come in. They are very sick. If you cannot see them now, I will have to call your attending.
I am the internal medicine attending on call today. I will be happy to help you, but need to assist this patient first. You called me because this patient had low blood pressure and because he was not making urine after you gave him 100 milligrams of Lasix. I looked at his chest X-ray and he has a bilateral pneumonia. I placed this patient on broad-spectrum antibiotics and am trying to give him fluid boluses because I think he is septic. I think he will need pressors and transfer to the ICU.
I am the ER attending. This is no longer my patient. He is your patient now. If he is sick, then you need to talk to the critical care doctor. I have 6 patients for you. They have been here since 5 o'clock this morning. It is 1 o'clock in the afternoon and they have been in the ER too long.
Well, okay, this patient seems more stable now. You can tell me about the first patient.
The first patient is sick.
Okay, why is he here?
Because he is sick. He needs to come in.
Okay, I understand. Can you tell me why he is sick?
He is very sick. He has abdominal pain. He needs to come in.
Interesting. I see. Can you tell me a little bit more about his pain? What do his labs look like?
We do not have labs yet, but they are cooking in the lab for you. He is sick.
How about your physical exam? Can you localize the pain anywhere?
We checked an abdominal and pelvic CT with contrast. Since he was confused last week, we also checked a head CT. He is sick. He needs to be admitted to your service for further workup.
I understand. But we do not know a possible diagnosis yet. Can you contact me once you have lab results and the CT results?
No, he is sick. He needs to come in because his last CT scan was when he had a small bowel perforation.
Oh my! Do you think that this current pain could be a surgical problem?
I do not know. We checked an abdominal and pelvic CT for you. But the radiologist has not read it yet. You will need to speak with him after it is read, and you can speak to the surgery service after the patient is admitted to your service if you think it is a surgical problem. You will need to transfer the patient to their service if it is. Hold on for a moment. I need to answer this call and I still have 5 more patients that need to come in. This is a very important call. Hello. Oh, you are. That sounds great. Can you order me the big salad? Please don't get the ranch dressing. That place has a bad ranch dressing. Do they have breadsticks? Oh no, those are too fattening. I can't eat the garlic ones. Can they make them without them? No, that will not be a problem. You can call me back in a minute. I am not busy. I can talk to you more about your date tonight when you call me back.
Oh, I am sorry. I need to return this page.
I still need to tell you about 5 more patients and I am expecting a phone call again soon. Can you please call it back later?
Well, I guess so.
The next patient is sick. She needs to come in. My nurse told me that she has a fever.
How high was her fever?
I do not know. You will have to ask my nurse. This patient is sick and she needs to be admitted to your service for further workup of the fever. This may be a fever of unknown origin.
Well, I am not sure yet. Can you tell me more? Why do you think she has a fever?
I have ordered a CBC. It is cooking in the lab for you. I do not know why she has it. That is why I am worried about a fever of unknown origin.
Well, I guess I will see her soon. Can you tell me about your next patient?
This patient looks very sick. He needs to come in.
Okay, tell me a little bit about this patient.
Can you hold that thought? This call is very important and I need to take it. Hello. Oh, hi there. They can? Oh, that's good. Did you ask them about the bread? Great. I know. I saw it on his Facebook post about 20 minutes ago. I can't believe it either.
I am sorry, but I really should return this page.
Katie, I have to go. This doctor is not being very patient with me. Can I call you back? I still need to tell you about that patient. He is sick and he needs to come in. I do not understand why the person paging you can't wait. Let me tell you about this patient.
I will listen. Please tell me more.
The patient probably doesn't need to come in. But I'm worried because right when I was going to discharge him to home, he said he had chest pain.
What brought him to the emergency room in the first place?
I am not sure. I think he came by ambulance.
I mean, can you tell me what his complaint was that brought him to the hospital?
He had a headache. I consulted neurology to admit and they said to give him Tylenol. I checked a head CT and called neurosurgery to admit, but they said there was nothing to do and told me to call medicine. I was not going to call you all, but he then told me he was having chest pain at the exact moment I was starting to write his discharge orders.
Tell me more. How old is this patient?
He is 25 years old. He has chest pain, he needs to be admitted and be ruled out. He has never had chest pain before and he needs to have a cardiology consult to investigate for cardiac problems.
Do you know if anything made his chest pain better?
I gave him morphine, nitroglycerin, and Maalox. Would you like me to put him on a drip for one of these? I can also put in a central line for you. I checked a BNP, troponin, and D-dimer. They are all cooking in the lab for you.
No, that is all right. I will need to evaluate him first. Can you tell me about his family history? Is there any history of cardiac disease?
His stepfather had very bad cardiac disease. He had a heart attack when he was 95 years old. This patient had chest pain today and needs to come in.
All of this is causing me to have chest pain.
I am an ER attending. If you are having chest pain, I can give you medicines. I will need to speak with the internal medicine service to admit you and rule you out for a heart attack. I will need to check a BNP, a troponin, and a D-dimer. I will also check a contrast CT of your chest to make sure you do not have a pulmonary embolism when the D-dimer is positive.